these current 64 inpatients, every one of these patients is in the hospital because they need inpatient treatment to help them battle the COVID-19 that they currently have. And so of those 64 inpatients, 60 of those are not vaccinated. 4 of them have been vaccinated. Of our 7 patients currently in the intensive care unit, 6 of those have not been vaccinated. And all of our patients who are currently on ventilators have not been vaccinated. There's a further breakdown by age groups there, but the message is same. And I think this picture is worth 1,000 words, is you can see that this hospitalization trend we're currently seeing with COVID-19 is largely among unvaccinated individuals. It's one of the reasons why we wanted to talk to our community again tonight, talk about the importance of vaccination and why, if you have not yet been vaccinated yourself, please go get vaccinated to protect yourself, your family, your loved ones, and our civilization. It's a duty kind of for all of us in civilization to be vaccinated. It's like, this is one of the things I talk about. It's we all want to enjoy the benefits of the civilization that we're lucky enough to live in, right? The grocery stores we get to go into, the malls to go shopping, the sporting events, the concerts, all of these things we like to do as part of our civilized society that we all participate in. Well, when we have infectious diseases around that can impact public health and safety, vaccination is a routine requirement to be able to participate in a civilized society. And we have a vaccination now to help us prevent the spread of this deadly virus, the coronavirus. And it's why I encourage everybody, please, it's part of a public health requirement that we all have to participate in civilization with one another. Please get a vaccine, not just to protect yourself, but to lower the overall incidence of coronavirus in our communities to protect everyone. And so that's my plea for everybody here tonight. Please get vaccinated as quickly as possible. When we have this many inpatients in our hospital, it starts to impact the care that we can provide to everybody who needs care for other medical conditions, the strokes, the heart attacks, the untoward things that happen to folks every single day where they need medical care. And when we have this high coronavirus burden and COVID burden in our hospitals, it adds additional layers of friction, visitation requirements, and other tactics we need to put in place in the hospital to make our facilities safer. And we could avoid all of that if everybody was vaccinated, right? And we could provide better care to everybody who needs it when they need it.
Thank you, Dr. McDermott. That's a great snapshot of what's happening. And that infographic is pretty telling. We've been getting a lot of chatter about that online since posting it yesterday. And can you talk a little bit about the differences between vaccinated and unvaccinated patients? Are we seeing a difference in the level of care they need, or, is there other things we need to know about that data?
Yeah, I can definitely speak to that. Being a hospitalist, we are the ones that are caring for these patients when they're coming to the hospital. And unfortunately, what you do see is that those patients that are unvaccinated definitely tend to have a higher severity of illness. To Mike's point, those are the patients that are on the vents. And so by just looking at the data and what was presented in that depiction there, you can see that the overwhelming majority of the patients that are really getting sick and really ill and overwhelming the system are those that are unvaccinated. And I know that we're probably going to come to the point where we're going to say, well, what about those patients that are vaccinated? And what's the benefit there? And the reality is that there's a tremendous benefit. We're not seeing as high of acuity of illness. We're not seeing those patients that are vaccinated getting as sick as often. What you are seeing is that when they are getting sick, they tend to have some other underlying illnesses that put them at increased risk. So yes, there is still a chance that a vaccinated individual can get sick. However, the chances of them being hospitalized and dying are much lower.